Good afternoon. It is April 2nd, and I'm just here in my office with thoughts about metabolism and how to help people see what they need to do to improve their quality of life. My position on this is very personal because I have a experience with family members that have dealt with what we're going to cover here, and particularly has to do with something called metabolic syndrome. Metabolic syndrome is also known as prediabetes. There are 7 out of 8 of us in this country that are dealing with metabolic syndrome. But here's the catch. No one's going to talk to you about this because it's not the disease, it's the pre-stages before you get the disease. Now, people fail to realize, and I was included as well, despite my training and my education, that you lose your health way before you get the disease. So, what's really important in today's world, but is not practiced, is preventative medicine, being proactive. It's kind of like you're dealing with fire department. What does the fire department want you to do? Make sure your sprinklers are functional. Make sure the fire extinguishers are working. Make sure there are escape routes. Make sure the potential hazards are eliminated or avoided or reduced when it comes to things that can lead to a fire, because it's much better to have an ounce prevention because it's worth what? A pound of cure. Well, an ounce prevention can also be worth a pound of fat, by the way, because we have to make modifications. Before we get into the health and the science and the minutia of what is metabolic, I want to ask you one question. Do you change the oil in your car? And many people understand it's a common practice and common sense to change the oil in the car. The better question is, why do you change the oil in your car? Somebody told me. Okay, but why? It's important for the engine. Okay, but why? It provides lubrication for the parts to move. Okay, why? Because there's a lot of heat and friction. Okay, these moving parts, metal, are moving in the engine. And after a while, it starts to wear down the engine and you can have engine failure. Having a fresh oil change helps the engine live longer. If you talk to any mechanic and you say, what's the one thing I could do to make my engine, internal combustion engine, we're assuming in today's modern world of hybrids, what's the one thing I could do to have my engine last the longest? And if not, most, if not every mechanic will tell you it's change the oil to the engine. You might say, okay, I do the oil change. What else can I do? Check the rotation of your tires. Why is that? It helps with fuel efficiency. Sounds good. What else? What about driving? What about actually way of handling a car? You know what? Most accidents happen at intersections. Be especially careful before you cross the intersection. Before you go straight in because you see a green light, look left, look right, look left again as a pedestrian or someone who's in the car. Someone can be in a rush, be distracted, and go through that light. Just taking an extra look to the left to see that that car is trying to squeeze through that last light before you go into the intersection could help save your life. It's about prevention. It's about being proactive. In today's world, we're a very reactive society. Number one, because we have to wait for something to happen so we can have a response to it. Number two is because we have an on-demand society. We want something, we pick up this phone, and we can text, and we can get food delivered to us. We're an on-demand society, and we believe that if we need something, we can get it in a microwave minute. When it comes to tending to your health, it's more like a garden. It's more like something you have to nurture, just like a friendship, just like a relationship. Just your health is the same way. Your spiritual health, mental health, physical health, financial health, emotional health, mental health is all something you have to nurture. So when it comes to physical health, let's get into it. My name is Dr. Joe Scalia, and I'm a chiropractor for 24 years today. Today's my anniversary of being a chiropractor. And what I've learned throughout the years is that there is the outside body, the anatomical structures, your muscles, your bones, your ligaments, your joints, etc., your skin, however. And then there's the internal part of your body where you still have structures like your kidneys and your liver, your stomach, your esophagus, all these types of things. But guess what? You can also have an understanding on how your body works, the chemistry behind your body. So when we're talking about metabolism, we're really talking about the chemistry of your body and how it works. So when people go to the doctor, they find out insights to their chemistry. They look at the HDLs, which is what all used to also be known as your good cholesterol. They look at your triglycerides, which is an indicator of how your body is storing energy, particularly fats. When you eat a lot of carbohydrates, they get converted over to triglycerides. We can also talk about different types of things like sugar levels and that how it can be measured with your fasting blood glucose levels or glucose tolerance levels, or you can also look at something called hemoglobin A1C. So fasting blood glucose, typically at midnight, you stop eating. By 8 o'clock, you take a blood test. It lets you see if you're between 80 and 120. Typically 100 is ideal. Hey, you're managing your glucose. Your body knows what to do when that glucose comes in. But then there's also a glucose tolerance test where it gives you a whole bunch of glucose, and then you see how your body responds to that glucose surge. After you have that glucose surge, what happens is your body goes ahead and negotiates and sees what to do with it. And lastly, we have your hemoglobin A1C. Your hemoglobin A1C is when you have your red blood cells, which have hemoglobin on there, which carry your oxygen on your red blood cells. But the red blood cell span is about 90 days. So if you see there's a lot of sugar being attached to this heme group, the hemoglobin A1C will be in higher reading. Typically, 6.7 or above indicates diabetes. But if the reading is low, it indicates that there isn't a lot of extra sugar floating around in your blood, therefore not attaching itself to the hemoglobin group, hemoglobin, and as a result, you'll have a lower HbA1c. So those are a couple of the factors. And the last one is waist circumference. Waist circumference is a pretty good indicator if you're dealing with pre-diabetes or metabolic syndrome. However, 1 out of 5 people can be overweight and metabolically healthy. Those people are called obese, metabolically healthy, OMH. Then you have another group of people that are thin. They look like rails. They have no weight, they're not heavy. They don't look fat at all. They don't have a belly, but they're considered to be TOFI, thin on the outside, but fat on the inside. What's making them fat on the inside? Their factors being off. Their HDLs are very low because they don't exercise. Their triglycerides are very high because they eat a lot of carbohydrates, specifically refined processed carbohydrates. They have a very high HbA1c because they have pre-diabetes or diabetes. You've met people who are thin who have diabetes, and you just look at these factors and you start to see it's important to know the inner workings of the body, not just the outside. So there are certain things you could do to look better in a bathing suit, in a bikini, and that's aesthetics, that's anatomy. That's what people see from the outside. People shouldn't judge you on the outside, but they do. There's a whole push right now in society to not fat shame people. And I don't agree with fat shaming people. It's not a good feeling. But the bottom line is people should not judge you on the outside, but quite frankly, they do. And it's up to you. If you're okay with the way you look on the outside, that's fine. But if there are some things on the inside that your doctor is not okay with, and it actually corresponds to the way you look on the outside, and you want to do something about it, then you have to take action. What do you do to take action? Well, there are 3 steps to taking action. Number 1 is becoming aware. We just talked about this, and now you have a little bit of awareness, whether it be your good cholesterol, HDL, your triglyceride level, your sugar levels, your blood pressure, which we didn't talk about either. Blood pressure should be a certain amount. 120 over 80 is typically the standard. But when that blood pressure starts to go high, it's an indicator that your heart is working harder than it should. And your waist circumference should be half of your height if you're a gentleman. So I'm 5'10", which is 70 inches tall. I should have 35-inch waist around my umbilicus or my belly button. Even if I suck it in, the visceral fat will be there. And if I go around and it's more than 35, it's a risk factor for cardiovascular disease. It's an associated risk factor. Is it automatic? No. I still have to look at the other 4 things besides my waist circumference, but it is an indicator. It's not, a red herring that it shows that it's a definite, but it's a potential problem. So we're back to being in a situation where you can do something about the outside if you're not happy with it aesthetically, or we can do something on the inside if your doctor is not crazy about it. In this day and age, when you go to see your doctor for a well visit or any reason, you might see him for a medical condition that you're dealing with or a trauma. And the doctor takes your blood pressure and takes your blood panel and says, okay, we're looking at your hemoglobin A1C and it's starting to go a little higher than we wanted to. Just keep an eye on what you're eating. Make sure you exercise and eat the right foods. What does that mean? What am I not eating? What should I eat? How should I modify myself going forward? Just watch out what you're eating. What am I eating too much of? What am I eating too little of? They never go into it. Why? Because it's lifestyle. Now, they don't have time to go into lifestyle with you because they're busy seeing the next patient with a with a medical condition or a lifestyle situation. But you have to be a expert on your body and find out what you need to find out to take care of yourself. You need to be an advocate for yourself because can we agree with one thing? Nobody's going to come to save you. You have to look out for yourself. Your health is your responsibility. And it's important to go find out what you can do to change the oil in your car, to make sure your extinguishers are not expired. That's your job to make sure your hemoglobin 1C, A1C is good, to look at your blood pressure and get it monitored, to take the walk 15, 20 minutes a day or whatever it is to keep you walking. You have to understand what you need to do and why. Because if you don't, then you're being ignorant. You need to get out of ignorance and into knowledge on how the body works. It can be overwhelming, but tons of things are overwhelming. I have no idea how this thing works, but I use it every day. You have to have, you can get a better working knowledge of how your body works because you're going to have to live in it every single day. So, what we want to do is establish three things: awareness, which we've kind of done in the first few minutes over here, 10, 11 minutes or so. And then we're going to talk about capabilities. Capability is understanding, being like the way you're literate when it comes to reading. You have to have nutritional literacy. You have to understand what you're putting into your body, why, what it's going to do for you. You are what you eat. It's important to understand what you're eating so you see what you're becoming or what you are. And there are ways to do that, but there's a lot of confusing information when it comes to that. You have to go with a program that works for you. There's so many different fads that are out there: South Beach diet, keto diet, Mediterranean diet, ketosis, all meat, carnivore diet, raw diet, vegan. Who do you believe and why? You have to do the research to find out what's going to work best for you. And it's going to be a system of trial and error. Now, of course, throughout this whole thing, this is general information for your, education and informational purposes only. I'm not here to diagnose, treat, or cure any disease. Any information here is something that you can discuss with your specific healthcare provider. And if he or she understands that you're making a lifestyle change for the better, they should not be against it. However, there are certain situations where you don't want to incorporate what I'm saying. I'm using general terminology. Let me give you an example. Somebody's on a blood pressure medication and they're supposed to avoid eating grapefruit. But then you hear from someone on the internet, hey, eat more fruits and vegetables. And you go ahead and you eat more grapefruit because you heard it was good to eat more fruits and vegetables. However, in your specific condition, you're supposed to avoid grapefruit because it can counteract with the blood pressure medication you're taking. So in that regard, you do need to have your doctor's advice for specific contraindications such as that. I'm not telling you to go eat more grapefruit. I can tell you the benefits of eating grapefruit. You have to know the um the dangers of having grapefruit in your circumstance. I hope that example makes sense. Awareness is key. We talked about that. Capabilities like being nutritionally literate. What are you putting into your body and why? Why does it make a difference? How do you track what your heart rate should be when you're working out? What kind of workouts should you do? What are the most beneficial exercises for you and your conditions? Meaning that if you have a previous injury, what do you like to do? If you have the capability to learn what works best for you, then you have ability to be expressing yourself into your best possible state. And lastly, I do the awareness. I help you out. I point you in right directions. You read the books, you watch podcasts, you listen to the audible books or what have you. You watch certain movies, documentaries on certain foods. Then we talk about it and we help you build the skill set of reading the information on a nutritional package, for example, or knowing what heart rate to work out at or how much exercise to do on an individual basis. We start to talk about things you do on a daily basis, such as sleep, how much water, how much exercise, who do you tap into, what are the resources, how does the body work? We help you with your capabilities of understanding how the body works and how to apply all the information we have on so many smart devices now, such as our phones. How do we apply it? We learn that capability. But the last part, and it doesn't matter how aware and capable you are if you're not willing. You got to find why you'd be willing to make a change. You essentially need to leave the old life and old way of being you had behind and start a new way of being. And when you leave that old way and old life behind, that person who you once were essentially dies, and a new person who you're going to become essentially goes on. The plants that you want to see grow in your garden thrive and sprout. And the weeds that have been there, kind of like automatically, that you didn't realize they were there the whole time, they get eradicated. Eradicate means to pull by the roots. Radical means root, like the square root is the radical sign. Radical people are square root, are a grassroots movement. Eradicate, eradicate. You eradicate the weed from your life and you express yourself on a better level. So it's been a brief talk here. If you want to learn and become more aware of what's going on in your body, if you're not yet, if you want to learn the capabilities to keep yourself in a better state of health, and especially if you're willing to make it a life that you want to live by design versus by default, especially if you're going to do it for maybe someone outside of yourself. I'm not sure what you're dealing with right now as far as a setback and some kind of health objective. Maybe you want to get back in your 34-inch jeans if you're 5'10". Maybe you want to look great in a dress when you go back for a reunion or a wedding. Women have this hourglass figure. Men have a V shape. They have broad shoulders and a slim waist. It gives them a more masculine V-shaped look. For some people, that's more desirable. Maybe they want to build more muscle tone as they get older, because as we get older, we lose muscle and we lose flexibility. That's part of aging. But if you build muscle and you stay flexible, you're actually anti-aging. Maybe you have no idea what supplementation you should take, but we can learn about it. We can become aware of what supplements do for you. You can become capable to see if they're working for you or not and measure them. And then you could be willing to be on a different trajectory. For example, take some fish oils to help with proper lipid management, particularly cholesterol, and see that what these lipids do for you for inflammation. That's a great example of what you can do. But it is in your hands. This is your health. Don't wait for someone else to do it for you. Do it for yourself. You're worth it. You deserve it. Get educated. Have someone be your metabolic tour guide. I struggle to find the right word. I'm a doctor. The word doctor means teacher. Doesn't mean healer or cure. The word document, like document, means to teach something. Indoctrinate means to teach someone. When you learn these things, that's what a doctor's supposed to do, help you with how your body works. And then what you can do is you can apply that knowledge and have better capabilities on how to manage your health, just like you manage your car, just like you take the filter out of your air conditioning every 3 months. It's the beginning of April over here. It's time for me to change my air filter. That's this Q2. Do it 4 times a year. A really good 90-day filter, pleated 3M. I'm going to change it when I go home today. It's automatic. After a while, when you do things, it becomes automatic. It becomes a habit. Habit is how you live. Habitación is from Spanish. Your habits is how you live. In Latin, you could say ego habitas in urbe. That means I live in the city. Habit is how you live on a daily basis. So you want to work on these habits and it will show up on how you live. And if you live a certain way, you'll get to have a life the way you want it. But it's got to be intentional. Does it happen overnight? No. But it happens if you do it right. It might not happen overnight, but it happens if you do it right. You have to understand how your body works. And that's what the whole point of it is. And you can do it on your own. Consider me a kindergarten teacher teaching you nutritional literacy, pointing you in the right direction. You can say, like a counselor, what should I read about now? I want to learn more about, Mediterranean diet. Read this book. Watch this, this series on YouTube. It points you in the right direction. But overall, we utilize encompassing informational sources that will help you and clarify the confusion in a lot of areas and get you on a path to where you continue to ask questions. You have to keep asking questions to get the right answers. It's so important. So I wish you the best on this journey. If I can be of service to you in any way, as I can be a metabolic tour guide for you. If you go on vacation, you can go ahead and take an excursion. If you go on a cruise ship, right? You're all on the cruise ship, and then people get off and they go on these excursions. Some of the excursions, I've done this before, is to go tour a city on your own. I did Florence on my own when I had my honeymoon, and it wasn't as good as when I had an excursion and there was a tour guide pointing out things. Yeah, it's adventurous to go out there on your own, but it's going to take a long time. The whole point about having a tour guide is not necessarily where to go, but it could be how to avoid tell people where not to go. So if you want to have that tour guide you through this journey to a better path of health, better metrics when it comes to your doctor, what he sees on the inside, and a better aesthetic when it comes to you, when you see on the outside, when you're standing in front of the mirror, if that matters to you, then reach out to me and we'll figure out a way to come up with a specific individual plan to plug you in into what will be the way for you to get to a better path to health. Thank you so much for taking the time to listening, and I look forward to hearing from you.